All right, imagine you run a little lemonade stand and you buy your lemons and your sugar for $1. But when someone buys a cup of your lemonade, you only get 10 cents. So you lose money every time you sell. Well, that is exactly what's happening to some pharmacies in Idaho, but with medication. Derica Kay spoke to two of them. And Derica, what'd you find out?
Well, Morgan, the problem comes from pharmacy benefit managers, or PBMs. They're giant middlemen between commercial health insurance as well as the pharmacy, and they decide how much money pharmacies get back when they give you your medicine. A new Idaho law requires them to provide fair pay for pharmacies to cover that cost. But two local pharmacies say those fees are still not fair.
And so because of that, we're not able to service all the prescriptions that we would like to and help everyone that we would like to. So ultimately, the people in the community are the ones that suffer.
Tyler Higgins is the owner of the medical clinic pharmacy in Caldwell, the last community pharmacy in the city. He says PBMs have been dishing out dispense fees so low that it's causing him to turn clients away.
Currently, 30% of all of our transactions from PBMs, we get zero dispense fee. About 50% we get between 10 cents and 25 cents. So last year I had to drop one of the major PBMs, which was about 20% of all of my patients.
The dispense fee is the money pharmacies get paid for the labor it takes to prepare prescriptions. When PBMs pay only a few cents or nothing, the pharmacy loses money every time they fill a prescription. And it puts pharmacies in jeopardy of also losing employees.
I actually had to lay off one employee already. It's something I hate to do, but...
Anthony Hollis is a co-owner of the Hollis Family Pharmacy in Emmett. He says his pharmacy opened only 6 years ago, and his business is already taking a hit.
Yesterday alone, I had several claims that I got 10 cents total. You know, I got 27 cents total for a 90-day supply. That's just not sustainable.
Hollis says that it generally costs him $12 to $15 to fill each prescription, which he says should be the fair amount he receives to maintain good service.
And a lot of people say that, you know, paying us this would raise people's, you know, premiums and their copays, but there's so much money in the system and healthcare costs are still going up 10 to 15%. So pharmacies are not making money. Where's all the money going?
The top 3 PBMs in the United States are CVS Caremark, Express Scripts, which is owned by Cigna, and Optum Rx by United Health Group. Together, these 3 control around 80 to 90% of the PBM market and have significant influence over drug pricing, pharmacy reimbursements, and what medications insurance will cover. State Representative Jordan Redman is one of our state lawmakers who has been trying to tackle the issue. While sitting on the Health and Welfare Committee, he helped pass a new law that took effect in January 2025. This law helps regulate PBMs.
In the bill itself, it prescribes to have a fair and reasonable cost for a dispensing fee.
According to Redman, the law passed 2 years ago, putting the Department of Insurance in charge of setting that fair price.
Right now, I don't think that's been determined completely from the Department of Insurance. They were doing a number of studies and figuring out what that looks like.
Because of this, PBMs are still underpaying.
There's going to be action taking when we get back to the legislature in January, but right now it's a matter of trying to, you know, deal with this issues in between and figure out how we can sustain pharmacies.
Redman says the new law outlines consequences if PBMs do not offer a fair dispense fee, including fines and penalties from the Department of Insurance.
If we continue to allow PBMs to use these unethical business practices, there's a good chance that we're going to see more and more pharmacies go out of business, and we're going to see lack of access.
The pharmacies in Emmett and Caldwell say they have filed dozens of complaints with the Department of Insurance within the last year. I did reach out to the Department of Insurance for comment, and the spokesperson sent us a statement saying, part quotes, "The department has been very engaged in fulfilling the provisions of the law outlined, and we have received hundreds of complaints from pharmacists, and we are diligently reviewing each complaint and the evidence submitted." End quotes.
Okay, so Derica, just to clarify, these PBMs, like you said, are middlemen between commercial health insurance companies and pharmacies, but You noted that 2 of them at least are owned by insurance companies themselves.
Yes, and those insurance companies also own their own pharmacies.
What a system. Okay, Derica, thank you so much.